want to talk a little bit about HOCL. So I mentioned before that the opportunity to pick up the virus through your hands or through your face or through your clothing is pretty high. And you cannot really spray Lysol on your best shirt, in order to disinfect it. And you can really not spray Lysol into your shoes if you had any exposures on your socks, because it will simply burn a hole in your shoes and your socks and your skin. And so we were looking for a disinfectant that is more on the biological side. And so the white blood cells, one of the first lines of defense from our white blood cells is the production of hypochlorous acid. It's a chlorine compound. It's also known under the name HOCl. That's a chemical formula. And there are several companies that make HOCl as a liquid, as a spray. They've found a way of stabilizing this usually unstable compound, where it's stable for at least for months and months. And so we use an off-label use with this. So first of all, when I get in my car, I spray the handle, I spray the key, I spray the steering wheel. If I go in a restaurant, I spray the plate in front of me, the fork, the knife, my hands, my face, and do that throughout the day many times. The beauty about this spray is it has a preference of killing pathogens and really does not harm your own resident flora that you need so badly to defend you. It's insane to overdo the hygiene and wash off all the beneficial bacteria and fungi and viruses that you have naturally on your skin that are protecting you. And so HOCl is for us has emerged as the ideal preventative tool. You can spray it in your eyes, in your nose, in your ears. You can spray it in your throat. And we have, and this is a true off-label use, pioneered inhaling it with a nebulizer. I use a handheld nebulizer from a British company called Omron, O-M-R-O-N. It's battery driven and it uses ultrasound to nebulize the substance in it. And so when you fill the little chamber in there, it takes about 15 minutes of an inhalation. And we've had experience over the last 5 years with it, using it in seasonal flus and pneumonia and lungworm and other situations with the lung that were very, very serious, and it had a phenomenal positive effect, adding that into the treatment.
Let's assume that you've been in a restaurant where somebody has sneezed on a table. You should know that the virus can survive on a surface, on a smooth surface, for about 72 hours. Once inside the body, this virus also lives on the surface of tissues. It doesn't penetrate deep into it, lives on the surface of the tissues. And the first tissue where it clings to is your throat and the mucous membranes of your nose and the eyes. And this is for many days after the onset of the first symptoms. It still lingers there before it goes deeper. So from the first onset of symptoms, let's say you get a sore throat, you get the feverish feeling, you have 5 days to treat the virus in areas that you can reach with a simple spray. And for our students here, you know my work with the hypochlorous acid, the HOCl spray, and I get into some science of that. And then the HOCl spray you can do in the eyes and in the nose, and again in the throat, but you can also inhale it. I want to show you this little tool here. This is the inhaler that we use. It's not very tall, and it creates a fine mist with HOCl. It's very pleasant to inhale it, and you can mist your eyes with it and the skin. You can put it in your mouth. You can put it on any body surface, and it's absolutely fantastic. The reduction of bugs that you achieve with that. You cannot spray Lysol in your eyes and any of the other things that are, or chlorine dioxide or chlorine bleach, but you can spray this in your eyes, and it's fantastic. And we've been using it for over 2 years for other illnesses, and it works. Okay, so after the 5 days past the onset of the first symptoms, the illness may penetrate deeper into you. And at that stage, when you get the dry cough and the severe form of the illness, then most of the density of the bugs are in the fluid in the lung. But again, 72% of it still is in the sputum, still in the throat. It lingers there for the entire duration of the illness, and the throat works as a growth medium for these bugs. And so anything you can gargle or spray onto the virus that is antiviral that will work is fantastic. Okay, so let's talk a little bit about HOCL. So HOCL, I call it here the mist that rocks. And so the first study that I'm mentioning here is done on MERS, the Middle East Respiratory Syndrome. Remember, that's also a coronavirus, and it had a death rate of over 30%. And what they did, they sprayed this virus on a work surface, on computer monitor and on the desktop next to it, and then used the typical recommended alcohol-based disinfectant to clean up the surface, and found out that was still positive with the PCR test for surviving viruses. Then they did the same with HOCL, and that made it completely negative. So the HOCL was 100% effective. The alcohol-based disinfectant was 100% failure. So there is science to this madness. Okay, so the next study just shows a general antimicrobial effect that HOCL has, and it should be used in hospitals and establishments related to the food industry. Not my words. And then the last study, that's sort of more like a white paper than a study, shows that hypochlorous acid has not tested for the COVID-19 because it's just too young. This thing is only 2.5 months old since we know about the virus. But hypochlorous acid has been effective to so many other similar coronaviruses that they say in the study there's a reasonable conclusion that HOCL will be effective in treating COVID-19. Good, here's one more study on the actual HOCL that we use, the top one from 2017 that's published. And the title, Stabilized Hypochlorous Acid Disinfection for Highly Vulnerable Populations, Wound Disinfection and Area Decontamination. That's exactly what we're using it for. And then the last bit that's in the frame down here is the expert opinion based on a study done at the University of Washington, where they spread a human coronavirus typed OC43 that's very similar to the one we're dealing with on different surfaces, and then sprayed HOCL on it, and then looked how many of the viruses would survive. They only did one test that was 10 minutes post-spraying and found that it was only 99.999% positive. That means 1/10,000th of a bug survived. So a very, very small number may survive, and it of course has to do with where you're spraying and how much you're spraying. So it is, in our opinion, in our experience, an extremely incredible, simple, inexpensive tool to minimize the chances of contracting the virus. And if you have it in the early days, to spray it wildly in your face in the different mucous membranes to help to minimize the growth of the bugs in those tissues.
Okay, according to Dr. Klinghardt, what we know about COVID-19, this virus will live on surfaces outside the body for up to 72 hours, and it will live on surfaces inside the body or on the surface of the body, the tissues, for up to 5 days. And what he's advocating is the use of a simple spray, HOCL, HOCL Solution, and to apply it to the body in various ways. So I will demonstrate those now. So what he's advocating is, first and foremost, that you can spray it on the surface of your skin. You can spray it in your eyes. You can spray it in your nose. You can spray it in your ears, and you can spray it in your throat. And then he's also advocating the use of an Omron nebulizer, a battery-operated nebulizer. I don't have one of those handy. It'd be handy to carry around with you. What I do have here is an ultrasonic diffuser that I picked up from London Drugs in Canada. And I have added a 100 parts per million HOCL in the solution chamber. And what he's advocating is that one can take the mist into the lungs, like that, and it actually feels quite nice on the eyes as well. And so to recap, what he's suggesting is that you throughout the day, many times throughout the day, that you can apply this on surfaces, on your plates if you go into a restaurant, and in your vehicle, as well as in your eyes, ears, nose, and throat. And then when you get home at night, if you don't happen to have one of the Omron nebulizers, you can sit in front of one of your diffusers here for say up to 15 minutes. Again, I'll state the disclaimer, I'm not a medical professional and I'm not advocating any medical advice here. I'm merely repeating information from a medical professional, Dr. Dietrich Klinghardt, MD, PhD. Thank you and be well.